and welcome to Healthgevity. I'm Dr. Kay Solar here with Dr. Curtis Solar, and we're going to be bringing you a series of videos talking about multiple health things. But since February is Heart Disease Awareness Month, that is going to be our topic for today. And we want you to always know that this is for information only, and that is not to substitute for your personal recommendations that may be given by your healthcare provider as far as diagnoses, advice, or treatments. But we want to share with you our heart health journeys, which really is what got us involved in Healthgevity.
I'm going to go first because
I'm going to let him.
Thank you. I started the journey at the age of 35. My dad, 55, who I thought was a very healthy person, had a massive heart attack. Some of his other family members had heart problems at even younger ages, but for some reason at that point, I thought they were not living a really healthy lifestyle. And my dad lived a pretty healthy lifestyle overall, and that kind of woke me up. I had already had my cholesterol checked at that point, but by the numbers, which are still unfortunately mostly being used, I would have not been at a high risk. I was slightly over 200. My HDL was a little low, but not at that point terrible. Luckily, modern lipidology was just coming into vogue, and one of my doctors that I was in practice with, when I was in a multi-specialty group, was an internist and became certified in lipidologist. And I was one of his first patients, and by the advanced testing that we recommend, obviously, I was at, I think it was 95th or 99th percentile. I was going to have a heart attack too at a very young age. And had I not known that, I would not have done anything. Unfortunately, at that point, math's terrible. Many years ago, 25 plus years ago.
Many years ago, and I'll tell you how it was.
Most of the recommendations that were given to me in the medicines that I've taken are no longer even on the market. So medicine is changing, and obviously somewhat controversial as to what is even appropriate at this point to being done for high cholesterol or bad cholesterol numbers. But anyway, I'm gonna let you tell, because after I've started.
First off, I want you to tell folks, because let's talk about cholesterol. It's not cholesterol. It's not cholesterol. So way back when we first started training, people would go and they would get just a total cholesterol number, just one number. I mean, through the course of our medical practices, it has changed so much. And then there was like the 4 numbers. Oh, you need to get the whole thing. It's going to give you your total cholesterol, your LDL, which is the bad cholesterol, the HDL, your good cholesterol, and triglycerides. And so those were the 4 numbers that you would then start getting. But it's more advanced now than that. And truly, when people go to their physicians, most of them are not getting the advanced lipid profiles that are available. And what Dr. Curtis was saying is that he wouldn't know that he was even at risk for heart disease had he not done. Well, you're high risk because of the family history.
No, I was without family history. My numbers were so bad. I am at high risk.
But you did not know that. If you did not know those numbers, you would not know that you were at such a risk.
I would not have gone and seen a specialist.
Right. And so you did that based on your family history. And so then you got this advanced lipid profile. So tell folks, what is an advanced lipid profile? I mean, what are they getting that they aren't getting on the 4?
There's no one advanced lipid profile. Every company has their own numbers, and their own normals, and different doctors have what they can see. And your normal is not necessarily normal for you. It depends on your age, your history, your family history, and what risk factors you have. So and that might be why so many doctors don't do it. And it may be, I think, actually a lot of just don't even understand that there is such tests available.
Right. Well, let's talk about what yours was abnormal, was the abnormal particle sizes. People go, what are you talking about? Abnormal particle sizes.
Yeah, at that point, they were doing testing that would tell you whether you had a large cholesterol or small cholesterol. And at that point, it was felt that small cholesterols were particles were worse than large, which is still somewhat thought. It's mostly because if you have a decent number of cholesterol particles, they're going to be small. If they are very large, you're not going to have a lot of particles.
But the abnormal size of the particles make it to where they don't carry the junk out of your vessels like they're supposed to. They don't function correctly.
They do not function correctly, and they're more likely to lodge in your blood vessel. And I love analogies. My favorite analogy on this one is we're sitting across from our sink, and it's why you don't pour oil down your sink, because it will clog your blood vessels. It will clog your sink just like a bunch of oil in your arteries will clog your arteries and eventually get hard, just like the grease in your sink would get hard and ruin your sink. It will ruin your blood vessels if you have bad cholesterol numbers. Particle numbers now is a better term for it, over your lifetime. People think, oh, I got stressed out and had a heart attack. Well, stress can obviously trigger an event, but it's the fact that you have bad cholesterol numbers, particle numbers, for your lifetime. Now they know that kids coming back who are had autopsies from Iraq, they notice 18-year-olds already had plaque, and so that's one of the things that kind of help people to say it's not just an adult old person thing. It's something that starts in teens, and we should all know it. Unfortunately, most don't ever even get it offered, let alone have it tested. But anyway.
Well, so I knew a little bit about advanced lipid profiles, and we both, because of him, and so we both worked for at a large OBGYN group and a hospital that took care of women. And one of the docs was doing a test. It wasn't covered by insurance, but it was only $100. And it wasn't looking for disease. It was basically a preventative test called carotid endomal thickness testing. And so
which I've had and I passed.
Okay, so I had that. And I really was going to find out a little bit more about the test, because it wasn't looking to see if your carotids were blocked and you needed roto-rooting or some kind of surgery because you were imminent for an event. It was looking to see the thickness of the lining of that carotid artery, the internal lining, to see, and it compared it in an age-related ratio. So as to what they would expect you to be. So I wanted to talk about it on the news, and at that time I was like,
because it was brand new.
It was brand new. Insurance didn't cover it. They were just starting to do it. It seemed like a very cool thing, and I wanted to be able to talk about it on the news that weekend, because I always brought new and innovative things that was going on and talked about health topics. And so the doc said, yeah, okay, come on over, we'll do you, you'll know all about it, you can talk about it on the news this weekend. So I go over, and he's scanning my carotid, and he's like, well, is there any family history? I'm like, yeah, a little bit in the men, but the women, they live forever. I mean, all the women, they're old. Dudes, yes. My grandpa had a heart attack when, he was in his 50s. My dad had a heart attack in 50s, totally different sides of the family there. But I'm like, but you can't even buy a cholesterol panel as good as mine.
Her numbers were
my
incredible.
HDL, good cholesterol, was over 100. I'm like, you can't even get that. You know, all my 4 numbers, the best looking. It was like, he was like, yeah, you're not going to have any risk for heart disease. Well, I go do this test, and the doc goes, well, I don't know, okay, something's going on here. I mean, your vessels are 15 years older than you. And I'm like, say what? 15 years older than me? I'm like, I don't like that. So he goes, well, I think we need to do this advanced lipid profile and see if there's something going on here. And I knew a little bit about that because I knew he had abnormal particle sizes was the issue, which he had found out on an advanced lipid profile. So I'm like, okay, so we do the advanced lipid profile, and it came back that I had something called lipoprotein A.
Little a.
That's true.
Lipoprotein little a.
Lipoprotein little a. Got to put that little in there instead of little a. To be totally correct. Okay, he's making me be totally correct. Okay, so lipoprotein little a. I had it. It's hereditary. Probably what my dad had.
And it's everyone has the lipoprotein little a. It's whether yours is normal or elevated. Hers was
Mine was elevated. And which means what it does is it corkscrews into your vessels and it makes things stick there more. So, which makes the intimal lining thicker, makes you greater risk for having a cardiac event. And so when I started looking into that, it's like, you know, you see the fitness woman who just did a big marathon, she's 40 and then she drops over dead. She possibly had lipoprotein little a.
It's one of the factors that when you see somebody who shouldn't die of a heart attack, and at a very young age, frequently very fit people, they fall over dead. It's not 100%, but most of the time they have lipoprotein little a elevation. And again, no one hardly checks for it.
No one even checks for it. Even
because again, it's not covered. But the crazy thing is, not even expensive.
It's not even expensive. And then if you know you have it, because they're not a drug that typically targets that, a lot of doctors don't even order it. Even if you have risk factors, you know, for it, it's just not ordered because there's not a drug that typically targets that. But we got very interested in it because of our family histories and have attended, you know, some cholesterol, you know, workshops, lipidology meetings, and there is things that you can do for it. It's just, it may not be the drug that treats lipoprotein little a, but yes, all your other numbers better look really, really good, just like, you know, mine did, thank goodness. And there are things that you can do with your diet and other things that can reduce your risk when you have a hereditary condition like this.
Even for people who don't want to take medications, there's things that can still reduce your risk. There's lifestyle approaches, dietary approaches, many things that can mitigate your long-term effects of whatever your cholesterol values are. And I am on medication because mine hereditary numbers were so bad that I did pretty much every dietary intervention that at the time that was known, and none of them. In fact, many of them, the diet that I was recommended by my physician actually made it worse.
But we are learning a lot of new things. Right. I mean, and definitely medicine is always evolving, and we're learning a lot of things that can be helpful. Yeah. And it's hard to decipher all of that yourself out on the internet. You're like, what does this even make sense? And so that's what we're hoping to do, is put a lot of our research that we have done personally and help share it with you. And we thought February is a great month to talk about heart disease awareness because a lot of women don't know, and we were both OBGYNs for like 30 years. Women are worried about breast cancer, they're worried about other cancers, they're worried about osteoporosis. They tend to not be worried about heart disease.
But heart disease is still the number one killer of women. It's the number one killer of men as well.
Both men and women.
It just happens a little bit later in women, and it happens frequently in a different fashion than it does. less dramatic fashion frequently in a woman, where a man has the widowmaker and a big, women can have that type of heart attack too, but they're frequently more the small vascular, microvascular disease, which leads more to heart failure in a different symptom presentation than it does frequently for men.
But I think for today, all I want you to know is, yes, heart disease is the #1 killer of both men and women. You can do something about it. You need to know about your family history. If you have risk factors, you probably should be thinking about getting that advanced lipid profile. But we're going to talk about in future episodes the difference between men and women's heart. A little bit about what you said, how symptoms can present differently, how our anatomy is different, that triggers different types of symptoms and the disease progression, and how not just drugs, but there's a lot of dietary and lifestyle modifications that you can do to reduce your risk of developing heart disease and succumbing to a heart attack. And so that was it for today's Healthgevity chat. Unless you wanted to bring in the tail and say anything else?
No, you did it so well, there's nothing left to be said.
I just love that. So always be nice. It also helps your heart. And that's the end for today.
Thank you.